Our today's topic is the anatomy of the left atrium and the left ventricle of the bovine heart. Now, the left atrium, it is usually larger as compared to the right atrium. The left atrium, it forms the posterior part of the base of the heart, and it lies behind the pulmonary artery and the aorta, and it is present above the left ventricle. As we know, the atrium, it is composed of the main cavity that is known as sinus venosus and a blind diverticulum that is known as auricular appendix. Here the left atrium is also comprised of the same sinus venosus and auricular appendix. The auricular appendix, it is larger as compared to that of the right atrium. The sinus venosus, it is separated from the right atrium by interauricular septum. So here this is the left atrium. The left atrium, it is located just above the left ventricle and behind the aorta and the pulmonary arteries. And this is the main cavity that is known as sinus venosus or sinus venorum, into which the pulmonary veins open. Now coming to the internal structure of the left atrium. First, the left atrium, it is lined with a smooth gelatinous membrane that is known as endocardium, and there are openings of the pulmonary veins on the roof of the main cavity, that is the sinus venosus. These pulmonary veins, they are not guarded by the valves, as we have seen in the aorta and the pulmonary artery. This left atrium, it is also lined with the muscular ridges. They are known as musculi pectinate. These musculi pectinate, they are few in number and they are larger as compared to that of the right atrium. On the floor of the main cavity of the left atrium, there is an opening that is known as left atrioventricular orifice, which is guarded by bicuspid valve or mitral valve. Now the left ventricle. The wall of the left ventricle, it is 3 times thicker as compared to the right ventricle. The left ventricle, it is conical in the outline, and the left ventricle forms the entire posterior part of the heart, and it forms the apex of the heart. Now coming to the internal structure of the left ventricle. It is lined with first the endocardium, then there are musculotendinous bands as we have seen in the right ventricle, which extends from the outer wall up to the interventricular septum. They are known as moderator band. Here the moderator bands, they are 2 in number in the left ventricle. These moderator bands, they are more tendinous and branched. The muscular ridges, they are known as trabeculae carni, which we have seen in the right ventricle as well. Here the trabeculae carni, they are few in number and they are less prominent. The papillary muscles, they are 2 in number, and the papillary muscles, they are very large in size and they are located on the outer wall. As compared to the right ventricle, the musculi papillaries, they are generally 3 in number. 2 are present on the interventricular septum and 1 is present on the outer wall. So the openings of the left ventricle, there one opening is the left atrioventricular opening, which is nearly circular and it is guarded by the valve which is known as bicuspid valve and mitral valve. This bicuspid or mitral valve, it consists of 2 cusps. One is anterior and another one is the posterior. Here the chordae tendineae in the left ventricle, they are few in number but they are longer and stronger as compared to the right ventricle. So this is the structure of the left atrium and the left ventricle. So this is the left atrium. This is the main cavity into which the pulmonary veins open, and here this is the blind diverticulum that is known as auricular auricular appendix. This is the wall of the left ventricle, which is thicker, almost 3 times thick as compared to the right ventricle. And these are the musculotendinous cords. They are known as moderator bands, which prevent the over distension of the ventricle. And these are the musculi papillaris, which are 2 in number. They are present on the outer wall. They use attachment to these fibrous cords. They are known as cordi tendini. These cordi tendini, they are few in number, but they are longer. They are longer. And this is the mitral valve or bicuspid valve. These are the cusps. These are the cusps of the bicuspid and mitral valve. Now there is another opening present in the left ventricle that is known as aortic opening. This aortic opening, it is present on the dorso-anterior aspect of the base of the ventricle. And this opening, it is guarded by the valves. They are known as aortic valves. These aortic valves, they are composed of 3 semilunar valves, which are similar to pulmonary valves, but they are thicker and stronger. So this is the cross section of the ventricle. This is the pulmonary orifice. This is the aortic orifice or aortic opening. So this is the aortic valves, semilunar valves. These are the 3 semilunar valves or aortic valves. So these just periphery to these valves, there are the sinuses. They are known as aortic sinuses, from where the coronary artery arises. This one is the anterior aortic sinus or sinuses of Valsalva, which gives origin to the right coronary artery, and this is the left posterior, which gives origin to the left coronary artery. The interventricular septum is placed obliquely so that the convex surface faces and bulges the right ventricle. The concave surface faces backwards into the left ventricle. So here, this is the cross section of the ventricle. This is the right ventricle and this is the left ventricle. So the cross section reveals that the left ventricle, it is circular, while as the right ventricle, it is concentric in outline. This is because of the reason that the interventricular septum, it is placed obliquely and it bulges into the right ventricle, so that the convex face that is facing towards the right ventricle and the concave surface that faces towards the left ventricle. Thank you.